We already know there are 5 classes. We do some revision. Like first is sodium channel blocker, second is beta blocker, third is potassium, fourth is calcium channel blocker, the fifth is a miscellaneous class. In the miscellaneous there are 4 drugs: digoxin, atropine, mgso4 and adenosine. Now we are talk about mgso4 and adenosine. So first, adenosine. Adenosine and mgso4 both are used in the emergency acute condition, so they are used as IV. Now first, adenosine. It has 3 mechanisms of action. It blocks the AV node, it causes a bronchoconstriction, and it causes vasodilation. It is depend on its receptor. Like in the AV node there is presence of adenosine receptor 1, so it is a G inhibitory receptor, so it causes AV blockage. In the bronchus smooth muscle there is GQ receptor, and GQ receptor increase the calcium inflow inside the cell, inside the smooth muscle, so it causes bronchoconstriction. And G stimulatory cause vasodilation, because it is depend on cyclic AMP mechanism, which causes vasodilation. So there are 3 mechanisms of action. According to mechanism, you can also remember its side effect. Like due to bronchoconstriction, it may cause dyspnea in a patient, and it is contraindicated in COPD patient because it causes dyspnea. So asthmatic patient and COPD patient, adenosine is contraindicated. The side effect due to this mechanism is dyspnea. It causes vasodilation, so it is used as, due to vasodilation it causes hypotension. So during surgery, to minimize the blood loss, adenosine can be used, but it is not a drug of choice. So due to this mechanism, you can remember it used, like it is used to maintain the lower range of blood pressure during surgery. And the side effect due to vasodilation, you can know that it is a flushing, so it causes flushing due to vasodilation. So contraindication is bronchial asthma and COPD, and the side effect is flushing and dyspnea. And how to give? So we know that it is given IV in the emergency acute condition. Mainly it is used as antiarrhythmic due to this AV nodal blockage effect. And the half-life of adenosine is 1 to 5 seconds. So when we give IV injection in the arm, so it takes, in the forearm, it takes about 8 seconds to reach the heart, but the half-life is only 1 to 5 seconds. So how to give? First you have to give adenosine injection. Immediately after injection you have to give IV push of saline, so that it can rapidly reach the heart. And you can also, there is maneuver that when the patient is in supine position, first you give IV adenosine, then you give IV push, then immediately you prone the patient, so that drug within this time duration can reach the heart and produce its effect. Otherwise there is no significance, because it is a short test acting antiarrhythmic drug. What is used? So we know that it blocks the AV node. When we block the AV node, the impulses from atria cannot reach the ventricle, so it is used as a ventricular rate control in atrial fibrillation or flutter. So whenever there is supraventricular tachycardia or PSVT, means atrial tachycardia, atrial fibrillation or flutter, we prevent that the impulse should not reach the ventricle, otherwise it may produce ventricular fibrillation, which is more dangerous. So it is used as a rate control in SVT and PSVT, and it is a drug of choice. So when patient come in emergency, we took the ECG and we found that patient has PSVT or SVT, the first thing that we have to give is given IV adenosine. So it is a drug of choice in one condition. You can remember only one use, which is used as rate control in supraventricular tachycardia and PSVT. How to give, you should know. And it causes vasodilation, so we can know that it is used in surgery to maintain the hypotension, so that there is less bleeding. The side effect we already know. Due to bronchoconstriction it can cause dyspnea, and due to vasodilation it can cause flushing. And the one other side effect, that in atrial fibrillation adenosine is contraindication, because it also causes opening of potassium channel. So if the potassium channel is open, it go outside, so there is a rapid action potential due to this increased activity of this repolarization. So in atrial fibrillation adenosine is contraindicated. So we have to use, there are 4 drugs, ABCD: adenosine, beta blocker, calcium channel blocker, and digoxin. This 4 drug is AV blocker. So as a rat control, we can use this 4 drug. If the patient has atrial tachycardia, we have to use adenosine. But if the patient has atrial fibrillation, we cannot use adenosine because it can itself cause atrial fibrillation. So we have to use remaining any drug you can use. You can use IV verapamil or IV smolol as acute emergency condition. And contraindication. So we already know that it is not given in COPD, in the bronchial asthma. The second contraindication is atrial fibrillation. And the important third one, you have to remember that in transplant heart, we have not given this drug. Okay, if the patient has transplanted heart, we cannot give AV node because we not want to block AV node, and some arrhythmia may be generated because there is not nerve ending which is perfused through the myocardium to supply it. So if you block it, may lead to some other conditions. So transplanted heart, atrial fibrillation, bronchial asthma, COPD condition, it is contraindicated. We know the side effect that it causes flushing, it causes hypotension. Okay, so it is all about adenosine. You have to remember. So the questions you have to remember is mechanism of action. You have to remember it one use, which is drug of choice. The side effect and contraindication is also important. You have to remember these 4 things about adenosine. When you read respiratory system in pharmacology, you also find this drug because it has bronchoconstricting effect. Okay, now we are talking about mgso4, which is also given in acute condition as a IV. The mechanism of action, that it blocks the calcium channel. Okay, so it blocks the calcium channel, so it is a calcium channel blocker. So normally, what is the action potential? So you know that it is like this action potential. During this plateau phase, calcium is come inside and potassium go outside, so that it is a plateau phase. One calcium come in, 2 potassium go outside, and it maintain the means constant voltage. So when we block the calcium cannot come inside, but the potassium can go outside. So this is also potassium go outside in this stage. So plateau phase will not occur and action potential just go downward. So it causes QT shortening. So in which condition we can use? Whenever there is QT prolongation, like torsades depointis, so we can use in QT prolongation. So it is also drug of choice. So when patient present in emergency, we took ECG, and in ECG we find that patient has QT prolongation and polymorphic VT. Polymorphic VT is ventricular tachycardia. So in ventricular tachycardia, there are different waves, means different morphology, some small and some large, like this wave. There is no P wave. So in this condition, we have to do as IV mgso4. So 2 gram IV mgso4 over 10 minutes is given. When the patient is stable, we have to find the cause of this condition. It may be congenital or it may be acquired cause. If it is congenital, to prevent the further attack, the drug of choice is beta blocker. To prevent the further attack of this ventricular tachycardia, we have to give beta blocker for long term in a patient who has congenital QT prolongation. Or if it is acquired, then we have to manage the cause, that why